Weeks. Thank you so much for joining. My name is Matthias Hasa-Gobsowicz. I'm a technical officer in the immunization department at the World Health Organization. And today, I will talk to you about a project that we are doing together with colleagues from PATH to identify, analyze, and prioritize combination vaccines. I'm here representing WHO, but I also have a number of colleagues in the project team who is joining me in this call, and they will help me answering some of your feedback and some of the technical questions that you may have. And that is Lakshmi from PATH. It's Bill Hausdorf, it's Bob Sintrin, and Farzana also from PATH, and they will help me to answer some of the questions that you may have. In this presentation, particularly in the later part of the presentation, we will want to ask you about specifically about the technical feasibility that we're proposing to assess how we can combine different vaccines. And that's where we would like to ask you to give us majority of your feedback, and that's where majority of our conversation will spend our time on. I also would like to ask you if you could use the Q&A function in order to ask clarifying questions. But if you have feedback specifically about the things that we are asking you for, you can either raise your hand and then speak at the dedicated time, or you can just put that feedback in the chat. There will also be another opportunity to provide feedback via email. I will share that presentation with you later on. So I think that's that. Allow me to start the presentation. Let me start with this slide, which is what is the goal and objectives of the projects today? Well, the reason why we had organized this call is because we would very much like to hear your feedback from IFPMA and DCVMN members on what are the criteria and the rules that we are proposing in order to assess the technical feasibility of combining different vaccines. And we plan to achieve that through a number of objectives, such as we will firstly present a rationale, the reason as to why we doing this project. We will then go through different steps of that project and explain to you in detail as to what that project is about. And then later, majority of our presentation will focus on the detailed approach to evaluate the technical feasibility of how we can combine different vaccines. This webinar, because of that, is very much aimed at experts who have expertise in vaccine manufacturing, vaccine formulations, and platforms. It is the very first consultation that we're having with industry, but there will be opportunities for additional feedback, such as through email or through additional engagements and calls, such as the one on receiving feedback on the proposed list of combination vaccines as we progress later through the project. The specific questions that we have for you today is number one, in what ways can the approach to assess the technical feasibility of combining vaccines be improved? And number two, whether the criteria and rules to define the technical feasibility, are they clear, comprehensive, and independent, but also whether they are appropriately defined and scientifically correct. So why are we doing this project? Why do we want to identify a list of combination vaccines? And let me start with the statement that vaccines over the past 50 years have made tremendous impact. It has been estimated that 154 million of lives have been saved due to vaccination over the past 50 years. What this means is that over the past 50 years, the number of vaccines that are being delivered has gone up. The number of immunization of shots that a child is being given during a single visit has increased, but also the number of immunization visits that a child needs to attend has also gone up. What that means is that the immunization schedules are very, very crowded, and they have challenges with optimally delivering existing vaccines and ensuring high impact of these existing vaccines, but also considering new vaccines that are in development, like TB, like Shigella, like Group B streptococcus, and being able to think, how can we already start thinking of introduction of these vaccines and ensuring there is sufficient space in the immunization program to allow for their delivery. And with these challenges in mind, we believe that combination vaccines could actually help us answering some of these challenges. They could do so by simplifying how vaccines are being delivered. By combining multiple vaccines into one, you are, for example, reducing the time that needs to be spent in order to deliver a vaccine. Increasing health impact. By combining a vaccine, you could increase coverage of a vaccine that would otherwise be a standalone vaccine and not likely to be introduced to countries' immunization programs. easing vaccine administration, such as by reducing the cold chain requirements for vaccines, or by reducing the number of required shots, hopefully leading to increased acceptance of vaccine combinations. But despite these benefits, there are still significant barriers to development and introduction of combination vaccines. Some of them are around programmatic challenges, which is that you can really combine vaccines only if they have similar schedules, similar number of doses, and similar target populations. You can only combine vaccines that have similar technical feasibility profiles, such as physical-chemical formulation incompatibilities. There are some known immunological interferences, or there are some known increased reactogenicity profiles. There is also challenges around commercial uncertainties, such as that if we propose for a new combination to be developed, what will be the demand of such a vaccine? Will that vaccine survive in an open market? But also clinical and development and regulatory challenges, such as the clinical pathways and the regulatory pathways to evaluate and to approve these vaccines could be very complex, lengthy, and expensive. And lastly, a policy vacuum. There is so far very little policy guidance and recommendations from public health communities about which combination vaccines should be priorities. And very often what we see is that combination vaccines, despite their multiple benefits, are not explicitly prioritized over multiple standalones. And we believe that one of the reasons for that is because it's not very clear as to how to value these vaccines, let alone how we can prioritize these combination vaccines. And that leads to uncertain demand, return on investments, and very few combination vaccines that exist in development. So because of that, what we're proposing to do in this project is to develop a framework that would help us to identify new vaccine combinations that are likely to be compatible from the programmatic perspective. So there could be a similar number of doses that target similar age groups, that could be technically feasible. So they have similar platforms, for example, or have similar formulations. They could be commercially attractive. So we understand that they could have market, and also that they represent value to immunization programs, such as through reducing an immunization visit and simplifying that immunization schedule. And we would like to do that in order to, firstly, inform investments in vaccine R&D, shape markets, but also inform these decisions that are taking place at the policy and regulatory level. So whenever colleagues in countries or policymakers at the global level are deciding how to evaluate combination vaccines, they could look at our framework and they could take some criteria and rules that we had identified and take these criteria and rules to help them make the decisions at the country and policy global level. So allow me just to go through the overview of the project. And what we propose to do is a staged approach whereby each stage we reduce the number of combinations that need to be evaluated, hoping in the end to finish with a short list of combination vaccines that we believe meet all of the criteria that are listed here. We start with a long list of vaccines, those that are licensed, and those vaccines that are in at least phase 2 clinical development. That gives us a long list of potential vaccines that are eligible for pairwise analysis. Onto these combinations, we then apply a feasibility of programmatic feasibility assessment lens, where we look at this long list of vaccines and we deciding from that list what is programmatically feasible, which vaccines can programmatically be delivered together. And that assessment allows us to shorten that list from a very long list to those vaccines that are programmatically feasible. And it's these vaccines that then go on to the next stage, which is the technical feasibility assessment, where we look at things as platform, formulations, manufacturability, etc. And by applying that lens, we were hoping to further shorten that list of eligible vaccines, for which we would then like to understand the commercial potential, and for which later we would like to use novel metrics to understand the value of these combination vaccines. So which vaccines do we plan to consider in this exercise? We would like to start with licensed vaccines, which already exist and are being used, and also candidate vaccines, which are in phase 2 and beyond that. We would like to exclude emerging infectious diseases because we would like to focus on endemic pathogens. And we would like to exclude vaccines that are only for high-income countries. We want to at least have some indication and some use for low and middle-income countries. They may very well be also used in high-income countries, but we don't want to just focus on vaccines that are for high-income countries. We would like to exclude vaccines that are for outbreak response because that's not where the challenges of immunization programs are. It's really in routine immunization where we have challenges in delivering existing vaccines and introducing new vaccines. And we would like to focus on those vaccines that, at least for now, are delivered to children under 5 years old. And also, lastly, we would like to focus on vaccines that are particularly considered for low and middle income countries. For example, if we have MMRV, and given that varicella is predominantly used in high-income countries, and so is mumps, we would like to focus on measles and rubella for this assessment. So here are 3 stages of the feasibility assessment that we are proposing that I just went through on 2 slides before. Programmatic feasibility, technical feasibility, and understanding commercial potential. And for each of these feasibility assessment stages, we have a number of criteria that we are proposing in order to evaluate whether a particular combination could pass that feasibility stage. And first, we are looking at program compatible feasibility, where we look at vaccines that have similar overlap in geography, route of administration, similar vaccine regimen in terms of number and timing of doses, trying to protect ages of children of similar ages in order to protect them. If there is some known incompatibility for co-administration, or if they may introduce some programmatic issues and benefits. Then we look at technical feasibility, where we consider vaccine platforms like polysaccharide conjugates, mRNA, where we look at physical and biochemical properties like pH, buffer, excipients, and where we look at adjuvants like aluminum salts, emulsions, manufacturing processes, but also storage conditions and stability. And lastly, we're looking at commercial potential. So we want to have some understanding of the potential market and the potential use of these vaccines, just to ensure that what we propose is feasible from the commercial perspective. And some examples of the things that we plan to look at is disease burden, barriers to intellectual properties, use cases beyond just routine immunization, like campaigns or outbreak response, older age groups, perhaps value in combining vaccines from the syndromatic perspective. So if we were to have vaccines combined together that could prevent major etiology of diarrhea, could that change the prescribing patterns, for example, and impact antimicrobial resistance? And also, we would like to consider those vaccines which are vaccines of priorities, which are existing priorities, and for which there is strong advocacy for including them in immunization programs. After that assessment, we would also like to focus on understanding the value of the prioritized combination vaccines. And the reason why we want to do that is because when we look at the current ways of understanding the value of vaccines and the value of combination vaccines, to date, they don't really fully capture the value of combination vaccines. They're missing important components such as opening a new immunization slot, or being able to introduce a new vaccine in a combination if that vaccine would not have otherwise been introduced as a standalone vaccine, or being able to increase coverage by already combining it with a high coverage vaccine. So because of that, we're doing some additional work to be able to identify these additional metrics that are specific for combination vaccines, and we will use them in order to evaluate the full value of these new prioritized combinations vaccines. I will now go through the technical feasibility component assessment of how we plan to combine vaccines. And in that staged approach, this is the 4th step, and it's the step where we look at vaccines that are programmatically feasible, and it's only those programmatically feasible vaccines that are eligible for assessment of technical feasibility. Those that will pass the assessment of technical feasibility will then be looked at from the commercial perspective, and for them, we will also assess their value. The criteria that we propose for the technical feasibility, we have 4 different criteria. First, we plan to look at vaccine platforms, conjugated mRNA, vectors, etc. We also plan to look at formulations such as pH and buffer, adjuvants, surfactants, preservatives. but also manufacturing processes, such as egg cell-based manufacturing or conjugations or different biosafety standards that will be required, but also storage conditions and stability. So what are the different storage conditions across vaccines and how do they impact the stability of an antigen, but also being able to deliver that vaccine in a real world setting? And all these 4 criteria would help us to determine whether particular vaccines can be combined or not, based on the rules that we're identifying for them. So what is the process for evaluating that technical feasibility? We are only looking at vaccines that are programmatically feasible for the evaluation. We then are determining the criteria, which you can see on the left-hand side, and rules for each of these criteria, for which we will then collect data for each vaccine product that is eligible for the assessment. We will then evaluate that data against these criteria and rules that we identify for these criteria to help us determine and predict the technical likelihood of combining vaccines, ranging from very likely, likely with changes, or not likely. And the only combination vaccines that can be put together that are very likely or likely with changes will move to the next stage of the evaluation. We will also identify some additional technologies that may be needed in order to combine these vaccines. There are also a number of assumptions, such as that we expect that studies will need to be conducted to confirm non-inferiority or immunogenicity or safety and efficacy of new combination vaccines when compared to standalone vaccines. So because of that, we have developed a number of definitions of feasibility as to how likely we can combine vaccines. Very likely vaccines are those that where combination is feasible with minimum or no changes. Likely with changes are those combination vaccines that are feasible, but with some targeted adjustments to the process, to the formulation, etc. New technology, where a combination vaccine that we propose very much depends on future innovation, and those that are not likely to be combined, where combination is not feasible without really major significant changes that would need to be done. What I will do in the next couple of slides is I will go through one criterion at a time out of the 4 criteria that I had presented, and I'll present 2 slides for each criteria. One slide that shows you the definitions of the criteria and the rules and the examples for each of the criteria that we had identified for vaccines that are very likely to be combined, and then another slide for those that are not likely to be combined. And what we would really like your feedback on is, and where we would really like to focus the discussion is on the not likely definitions, because these not likely definitions, this will be the one that will determine which vaccines are in or outside of the scope. And you will see that in the next couple of slides. So let me start with vaccine platform and the rules that we had identified for vaccines that are likely to be combinable. We have 3 rules here. The first rule is that same or highly compatible vaccine platforms are very likely to be combinable. And we have a couple of examples here, such as live attenuated vaccines like yellow fever and MMR, or oral vaccines like rotavirus and polio, inactivated vaccines like Japanese encephalitis or Hep A, rabies and Tdap, or mRNA vaccines like COVID and RSV and influenza. The second rule is that compatible or complementary platforms with formulation or delivery system adjustments are likely to be combinable with changes. And here some examples that we have are conjugated vaccines like pneumococcal conjugate vaccine and meningitis with Hib, enteric combinations like TCV, Shigella, paratyphi, or lyophilized and liquid vaccine on reconstitution and combined at the point of vaccination. The third rule that we have here are combinations that may require new technology with significant requirements for CMC or clinical development. An example here is an mRNA combined with non-mRNA vaccine, possibly through a lyophilized format. And that takes us to the next slide, which is the vaccine platform, which we believe are not likely to be combinable. And the rule here is that it's platforms with fundamentally incompatible stability profiles, delivery methods, or mode of the immune response cannot be co-formulated, because such combinations would very much destabilize one or more components. For example, mRNA with adjuvants or preservatives is very sensitive and could be destabilized. They could require mutually exclusive processing. For example, need for lyophilization for one, but not for the other vaccine, which would make it particularly unstable. They could also compromise immune responses, such as that one vaccine could induce Th1 responses and another vaccine could induce Th2 responses. And some examples here are mRNA vaccines with other platforms because of their sensitivity to preservatives, ionic changes, or changes to temperature. Live attenuated vaccines with inactivated vaccines because they could include stabilizers and preservatives that are incompatible with inactivated vaccines and could increase reactogenicity, or polysaccharide with conjugate vaccines because the desired immune response will not be achieved. So what I would like to do now is to pause here for a 10-minute conversation and hearing your feedback on the not likely combinable criteria and rules for vaccine platform. The remaining will come and we'll stop there later. So in order to speak, if you could please raise your hand. Rajinder, please.
Thank you. Thank you very much. Excellent presentation. And I think it is very, very timely. I am right now in World Vaccine Congress, and a lot of sessions are happening on the combination vaccines and, the technical feasibility of various vaccines. Few points which I would like to impress upon. One, when we are talking about the first criteria that you have listed down for the feasibility, in my opinion, I think technical feasibility should be the first part rather than programmatically compatible. Because if it is technically not feasible, it cannot be taken forward. So, and then we are talking about, we are using different lenses. If you're using only WHO lens, then I think public health impact should be the main criteria in terms of, mortality, morbidity, how much are we really going to have in terms of, DALIs and all that stuff. And then I think after technical feasibility and programmatically compatibility, value assessment and the prioritization, because different governments have budgetary constraints, and therefore they would prioritize one vaccine over the other. And if we are giving them a combination vaccine which may not be their priority in their country, then the whole purpose will be defeated. Then in terms of not likely, I have seen some of your suggestions. Of course, in the likely one, I would say the rabies plus Tdap. Honestly, I really don't understand the rationale for that, because the target audience is different, the disease burden is different, geographic spread is different. So what are we really talking about? Or likewise, JEE and HAPE. Again, I don't really see a rationality of the combination. So I think some of these points will have to be really debated, discussed, and then taken forward in what is the right way to go ahead. Thank you.
Thank you, Rajinder. And maybe if there is anything else who would like to provide feedback, and then I can answer, and then colleagues from PAF can also help me out. So I don't see any more feedback, so maybe I'll start answering. Oh, yes, please. Harshet Jean.
Hi, thank you. I'm Harshat. WHO should also make it clear, apart from what Mr. Suri mentioned, WHO should also make it clear how these vaccines, if rationally designed and accepted by all, what will be the modus operandi of their adoption? Thanks.
Thank you so much. And maybe I'll start answering some of these questions, and then colleagues from PAF can supplement. So on the technical feasibility coming first before programmatic feasibility, I think the reason why we had put technical feasibility second is because through this work, we don't want to be very prescriptive by saying only vaccines that for which technologies exist can be prioritized for combinations. We feel like there is a lot of technological potential that could be tapped into across all the different companies, and that these technological advancement may not be available to all. Therefore, we wouldn't want to be very prescriptive in saying this is the technology that exists now and it cannot evolve. I think through this work, we very much want to highlight the potential to work on particular technology or to answer particular research questions that would then enable to progress with different combination vaccines. So I think this is why we had put the technological assessment after the programmatic assessment, because we believe there is a value in itself of highlighting what are the technological needs in terms of research and developments in order to make these vaccines feasible. For how we look at the value, I think at the very end stage of assessment of the value, where we will be looking at novel metrics, but very much the public health impact will also be part of these metrics so that we can integrate the novel metrics of looking at combinations with existing metrics and be able to understand the full value of these proposed combination vaccines. In terms of countries' priorities, I think what we are hoping that here, the end product would be, is that as we have a structured, systematic, and evidence-based framework, countries and NITAGs, for example, in countries that are making decisions about in future introducing these vaccines into the immunization programs, they will be able to look at the criteria and rules that we are defining here, and then take these rules and embed them into the decision-making framework so that they can make their own decisions about which vaccines would be particularly helpful for their immunization programs. And lastly, on the rationale for combos, so I think from here, we are not looking here at the programmatic perspective. These are just examples where we're looking at two vaccines where the platform could work. So it's beyond all of the other criteria such as programmatic feasibility, but it's also beyond all the remaining technical feasibility questions that we are yet to go through. And that is also applicable for all of the other slides that you will see. This is just looking at one criterion at a time and not looking at all of the remaining criteria that would also determine whether a particular combination could work. And very much examples of these only. And to answer Harshad's questions as to how we can introduce and use these vaccines, I think this is particularly why we're doing this work, so that we could help later countries to be able to introduce these vaccines into immunization programs. And inevitably, this work will then need to be combined as the products progress through clinical development in developing target product profiles, full value of vaccine assessments, or identifying evidence to inform policy decisions, supporting that process through policy decision, supporting regulatory decisions, and so on to eventually get to a point where a vaccine could be introduced. And I hand over to colleagues from PATH if they would like to add anything.
Thanks, Matthias. I think you've answered it. I think, no, Suri, that these combinations are more in examples for a thinking process as to what type of vaccines can be combined. We still don't have the list of vaccines from a programmatic perspective. So unless that comes through, we won't be able to actually come up with the applying these criteria for development, further development.
Thank you, Lakshmi.
Yeah, thank you, Dr. Lakshmi. My suggestion would be, the examples should be more relevant to the reality, and then, the adoption is better always. Number two, in my opinion, I think we need to involve anti-X, very early in the game, so that, it is not that once the pudding is ready and it is, going to be served, and then we seek their inputs or advice, because they are the best people, particularly when you're talking about large countries. I think they would be the best people to suggest what kind of combination would become feasible and priority for those countries. So it will be easier even programmatically to quantify whether these would be the really needed vaccines. Thank you.
Thank you, Rajinder. That is very much the plan. So there's an ongoing area of work currently taking place where we are engaging RITAGs, NITAGs, to be able to tell us from the programmatic perspective what makes sense of combining vaccines. And the result of that work will feed into this analysis of technical feasibility. Jules, I see that you also have a question.
Yeah, thank you. This is really, really timely, and thank you for inviting manufacturers, which um, I I think most of us understand the programmatic benefits. I mean, and the population, of course, mothers don't like to see so many jabs in the poor child. Uh, but the business viability of combination is the history is not always that good. Can you speak to that? How do incentivize manufacturers to go into combination that are just they are complex, they are more complex to make. I think you pointed that well, and it's not always it's not when you combine, you don't have added benefits, at least for business. I mean, it doesn't come across that you one plus one is not equals two. Sometimes it's, well, I mean, hopefully it's not negative. Sometimes it's 1.3, and the complexity makes it just not worthwhile. So it just, I'm thinking out loud here. It's extremely, some combinations are extremely difficult. It takes longer to make. The stability is not obvious. I mean, I have probably a couple of technical engineering colleagues here that can attest to it, but it is hard. But the rewards in terms of business is not that obvious to me. Do you have any suggestion?
Thanks so much, Jules. I will respond in a second. There's just one more question from Michelle Gun.
Thank you. And Jules is one of my colleagues. I'm going to add on to what he said. I think in addition to the business cases that are, the pharmaceutical companies are struggling with, we also have to consider the regulatory hurdles that we have with WHO. I appreciate the presentation, and I did see a note about perhaps looking at existing vaccine combinations, but not having priorities for some of those, some of the combinations that were included. And I think looking at it through the lens of a industry, it's very difficult for us to manufacture a combination product specifically to meet these goals, and then also have the regulatory challenges of not only having to have it registered in a reference market, but also marketed in a reference market where they may want those other vaccines included. So I think it's a challenge that we see from our end, where we're very dedicated to supporting WHO and the markets that they support, but sometimes there's some challenges there that we encounter from a regulatory perspective, which goes hand in hand with the business case, and that there may not be a business case for our reference markets, and then therefore the regulatory process to get pre-qualification becomes longer.
Thank you so much, Michelle. And so let me respond quickly, and then I'll hand over to Bill, who will probably supplement on some of the questions that you have. So I fully agree, Jules, that inevitably proposed combination vaccines will impact the market in one way or another. I think this is the reason why we're proposing this early engagement with manufacturers. Here, it's more on the technical feasibility, but then as we move along and we progress with the project, on the other components of that feasibility and prioritization of different combinations. And then later, when we get to a final list of combinations or a draft final list of combinations, similarly to get your feedback on the feasibility of what we are proposing. So that's one reason, but the second also way to address this is looking at this commercial potential. And it's not to say that we are conducting a full assessment of commercial viability of these vaccines, but just to get some understanding, and so that we ensure that the vaccines that we propose are not completely off target, and it's not a vaccine that would be used in one small country, but that if we propose that vaccine, it could actually hopefully make success in the market. And what we have heard from stakeholders recently, various committees that we had presented this work to, is that in addition to benefits, one must consider the risks as well. And one of the risks that was mentioned is, what is the impact on the market for standalone vaccine if you now propose that for it to be in a combination, in the combination. And Michelle, to your question, we have had a regulatory consultation about a month ago where we brought different regulators together, and we proposed these different challenges and questions around what is the regulatory pathway of reviewing and licensing these combination vaccines. I think my takeaway from that is that going forward, we need to be much more pragmatic and flexible, and we need to recognize these additional benefits of combining vaccines versus having them stand alone, and very often not being able to use them because the immunization schedules are too crowded. But I hand over to Bill to tell you a little bit more about that and also to answer more the first question. Bill, over to you.
Yeah, no, I was going to say, Jules, what you said is in some ways the whole point of this exercise, that the issue is that people are not developing combinations generally, except for the adult respiratory viral space, because people, companies, developers are going, I don't see the value. I'm not sure I'm going to sell this. And the whole premise of this exercise of what we're trying to do is by systematically walking through and transparently working with NITAGs and RITAGs, walking through programmatic criteria, technical feasibility, and then some kind of commercial analysis, that it'll become clearer to developers, hopefully, that these are actually the combinations that people want. Because as you know, working at Merck, and I know working at GSK and Wyeth, otherwise you're guessing. I think this is a good combination. They should want this, and you find out they don't. And I've had that experience. I imagine Merck's had that experience. Sanofi, everybody's had that experience. So this is actually the premise here, is that by doing this kind of more systematically, transparently, we can get at this. And there is no question in what Michelle said about the regulatory, there's no question that is part of the challenge. There's a number of challenges in this whole thing. But I think starting with the programmatic, what actually makes sense to combine, and just getting there, which is ongoing. It's not in this call, but this is what we're really doing right now, is trying to say, just from a programmatic perspective, what would make sense to combine? You get a subset of those and you say, okay, now, are these technically feasible to combine, or how can we, do we think they are, or obviously not? So it's this whole thing, and I was go back to what Rajinder said. This is it's very easy, and it gets very confusing to go back and forth between technical and programmatic and regulatory, and well, what about this? And we're trying, maybe it's not going to be successful, but I think it will. We're trying to systematically walk through first the programmatic, then the technical. And at the same time, we have been, as Matteo said, trying to get at some of the regulatory issues. We had a separate convening, which we'll publish a paper on, you'll hear more about, to try to get at what are the specific issues with combination vaccines and how much harder it is on the regulatory side. But I think if everybody on the call was able to sort of just say, okay, I'm assuming you guys are going to figure out the programmatic side. You're going to come up with it. Today, we're just looking at the technical criteria. So when Rajinder said, rabies and Tdap doesn't make sense, I don't disagree. That was just put up there only to say the platforms we think are technically feasible to combine. Not that we're proposing this, or this is a good one, or it's even gone through a programmatic analysis. It's really to try to separate out, keep the programmatic away. We're going to deal with that. This here is simply, can we make some general rules, which we're trying to walk through, about what is technically feasible to combine, knowing there's other issues. So I don't know if that helps, but the end product, we hope, is through the process, you get to a few combinations, you get a framework of how to actually prioritize, and you get to a few combinations that people have already been going, yeah, okay, I see where you're getting, how you got there. RITAGs have said, yeah, this is interesting, so that there's much more guidance.
Great, thanks so much, Bill. So let's go back to the presentation, and there will be an opportunity to ask further questions in a couple of slides. So let's move on to vaccine formulations. And here, there are various aspects that you can look at vaccine formulations. Here, let's just focus on pH and buffer and for now, and look at those rules and criteria that we had developed that determine whether vaccines are likely to be combinable. And we have two rules here. One is that vaccines are very likely to be combinable if they share similar target pH for optimizing the stability, with buffers that could have comparable pKa values, buffering range, and also buffer capacity. An example here could be phosphate and histidine, which both have neutral to slightly acidic ranges which overlap. The second rule that we have developed is that vaccines that have different buffer systems or pH requirements plus minus 1 to 2 pH units are likely to be combinable with changes such as changing buffers, buffer substitution. And examples here could be phosphate and citrate buffers. Phosphate has a pKa value between 6 and 8, and citrate between 3 and 6.5, giving them a very narrow window of overlap, which could be changed by adjusting the buffer ratio or using other buffers like histidine buffer. And there comes also rules for vaccine formulations regarding pH and buffer, which will determine that vaccines are not likely to be combinable. The rule that we have here is that vaccines are not likely to be combinable if they require different pH environments, plus or equal 1.5 pH units, or use incompatible buffer systems with non-overlapping pKa values and also buffering capacities. The considerations here are that the pH requirements of one or more components, they fall outside of the range of the stable buffers, and that these buffers are chemically incompatible, or that there isn't a buffer systems that could maintain that stability for all of the vaccine components simultaneously. And some examples here are phosphate and acetate, where there's more than 2 pH unit differences. The acetate buffer is acidic, while the phosphate buffer is more neutral range, and there isn't any overlapping window of stability. Or another example is phosphate buffer with lipid nanoparticles, mRNA formulations, where phosphate may interact with lipid nanoparticles, destabilizing mRNA structure or interfering with its encapsulation. And again, let's pause for 10 minutes just to get your reactions to this not likely combinable slide and hear your feedback. I see, Rajinder, you have a hand up again. Is this the new hand or old hand?
It's a new hand.
Please go ahead.
But, I don't know. Honestly, this field should be left to the manufacturers to decipher, to decide what is combinable, what is not combinable, whether pH has to be adjusted or some formulation has to be adjusted or something. I think this is a very specialized area which manufacturers probably are the best people to take care, rather than WHO spending time on these kind of things, because this is something which I think has to come from the industry. So this is just a suggestion, but I leave it to you. I mean, you want to invest more time on this, or how to go about it?
I think, Rajinder, this is precisely why we are having this workshop, so that we offering a first platform to engage with manufacturers and to receive that feedback, and to be able to obtain some of these technical informations that would then help us determine which vaccines can be combined. There will be other ways to engage as well, such as through email, if you would like to provide additional feedback about some of these technical challenges of combining vaccines. So we're not saying that we will come up with all of these rules and we will end up determining it at all, but I think we want to highlight here that this is very much in collaboration and partnership with both DCVMN and IFPMA members to help us develop this component. Jules, I also see that you had your hand up.
Yeah, I mean, Rajendra, this is precisely, if I understood, that was the objective of this webinar. I mean, we are, as manufacturers, we are the center of the consultation. And from what I understood, and I don't know if my colleague Jeff Blue is on the line, the little I know that, yes, indeed, this is to the point. It's not there are no more combinations that are just at this point are not technologically feasible. And given 15 years, sometimes you can come with something. And that's one of the challenges that we are raising. I mean, if you have eternity, I mean, you know, you are not constrained by business imperative and whatnot. Like at some point, you will find a way. But I think we all run into problems. I mean, Merck certainly, Sanofi, Merck combined with Sanofi. I mean, there are all sorts of gymnastics that we have made with different combinations that failed. I mean, you know, because it just proven to be more challenging and not business feasible. Anyway, but I think the point is well taken. I don't know, Rajendra, if you are suggesting additional combination, but experts like engineer. I mean, I wouldn't be the person on Merck side. It would be the people who actually know how to do things, just to analyze all this potential combination and say, you know what, it works or it not. It's like salt and sugar at the same time in the same soup. But well, we shall see. There are things that we already know are not working, and what I'm seeing on the screen, that's so indeed not feasible.
Thanks so much, Jules. And I think it's very much the case. You know, we would really like to collect that technical expertise that sits within different manufacturers and developers. And it's, you know, we understand that some of it may be very much protected information, and we appreciate that. And there will be an opportunity to share additional feedback through email, should that be the case. And we would like to use this information not so much to make it to publish it and make it incredibly transparent, but more for us to help us develop that decision framework to help us then determine which vaccines are or are not feasible from the technical perspective. So
yeah, the good news is that once you fail, it doesn't hurt to tell the world. So the protection is when you are still hoping to succeed. So I probably, and I can sort of like see internally if we can provide that information. There are things that we know didn't work because it's technological, and that I don't think that we have problem sharing that. But I need to double check.
Thanks so much, Bruce. Appreciate that. So let's move on to the next consideration, which is vaccine formulations. And here we want to look at adjuvants. And we have two rules for vaccines that we believe are likely combinable based on adjuvants. The first rule is that vaccines are very likely to be combinable if they use the same adjuvant type and formulation or are non-adjuvanted, and there is no evidence of immunological or physicochemical interference. We have two examples here. One is aluminum hydroxide, which is a widely used antigens with various vaccines like DTP, Hep B, HPV. And there is proven compatibility of that antigen with multivalent vaccines. And also aluminum phosphate, which is used in combinations or interchangeably with aluminum hydroxide, often compatible in co-formulated vaccines where pH and antigen absorption can match. The second rule that we have developed is that vaccines are likely to be combinable if they use different adjuvants, which require changes like reformulating antigens for shared absorption, adjusting adjuvant dose, or selecting a single compatible adjuvant system. And an example here is AS01, which is QS21 and MPL in liposome. And here, if we use different antigens, they will have to be formulated to allow for liposomal delivery of that with that antigen. And the slide that determines the rule of vaccines that are not likely to be combinable based on adjuvants. The rule here is that vaccines are not likely to be combinable if they require adjuvants with incompatible physicochemical properties, delivery systems, or immunological mechanisms, and cannot share a common adjuvant platform. The reason for that is because such combinations could result in aggregation, precipitation, or destabilization of antigen-adjuvant complexes, They could also induce different immune pathways, like one could induce Th1, another Th2 immune pathway, or result in unacceptable stability or reactogenicity profile. So again, let's just pause here for 5 minutes just to get your feedback, and really inviting additional colleagues to speak up and to share their first reactions on the rules around combining adjuvants. I'm not seeing any hands. I see, colleagues, that you're also putting some feedback in the chat, which is great. We'll collect that feedback later on, and then we'll use it to inform our work. But as I'm not seeing any reactions to the antigen slide, adjuvant slide, apologies, I propose to move on. Maybe your thoughts will come in later as we progress through the presentation. So we will have one more set of rules around vaccine formulations. Here, it's about preservatives and surfactants, and rules for vaccines that are likely to be combined. Vaccines are very likely to be combinable if they use the same preservative and surfactant, and these excipients are known to be broadly compatible with the antigens that are involved in these vaccines. And there are two examples. One of them is 2-phenoxyethanol, 2-PE, which is a widely used preservative in multi-dose vaccines. It has low reactivity, and that makes it compatible with a wide range of different vaccines like pneumo, meningococcal, HIP. Another examples are polysorbates, PS80 and PS20. These are non-ionic surfactants that help to prevent aggregation of proteins, and they also improve antigen stability. They're widely used across different vaccine types. The second rule is around vaccines that are likely to be combinable if they use preservatives or surfactants that are not universally compatible, and they require changes such as antigen stabilization, excipient substitution, or changes to production process. An example here is a surfactant like Triton X100 or sodium deoxycholate, which are used in protein solubilization or purification, and they may require removal or adjustment during final formulations. And what we think is not feasible is that vaccines are not likely to be combinable if preservatives or surfactants used in one vaccine irreversibly degrade, destabilize, or denature antigens, adjuvants, or delivery systems in the other component of a vaccine, and there isn't a formulation pathway which wouldn't compromise efficacy or safety. This is because such combinations could cause irreversible degradation or loss of potency. They could lead to aggregation, precipitation, or loss of antigen, and also interfere with complex delivery systems such as lipid nanoparticles or emulsions, because these are highly sensitive to chemical excipients. Some examples here are certain preservatives like thimerosal, which are incompatible with specific antigens like IPV or mRNA because of their oxidizing or denaturing properties, or like Triton X100 or sodium deoxycholate, which can irreversibly disrupt protein conformations or lipid-based systems if they're not appropriately controlled or removed from a combination vaccine. So again, let's just have a 5-minute conversation here to touch on some of these points and your reactions to likeliness or unlikeliness of combining vaccines based on the preservatives and surfactants that are included in a vaccine combination. Jules, go ahead.
Yeah, I'm just my colleague Jeff Blue is mute. He's the technical expert on this thing. I wonder if he can comment.
Jeff, would you mind
Yeah, sorry, I just had to try to get off mute, right? So from a preservative perspective, we don't utilize a lot of preservative in vaccines, at least within Merck, right? Because of the impact to stability most of the time. So it would make it much more challenging to try to combine different vaccines that had or did not have preservatives. Combining vaccines that have similar surfactants, yes, I would agree, make it a viable option to be able to combine those into it. We just stay away from preservatives most of the time unless you are making multi-dose type vaccines, just because of the impact it has the stability profile associated with those vaccines.
Thank you so much, Jeff. Very much the case. I mean, mostly preservatives we're talking about here in case of multi-dose vaccines.
Yeah, most of the multi-dose that we use don't even conserve them, right, for some of those LVVs because they will degrade the antigens upon reconstitution. So most of the time you use the 6 hours of use rules for being those multi-dose.
Yeah, very well. Thank you. Noted. Anyone else, please? Colleagues, please do not be shy. We have invited you here to help us develop this work. So we really appreciate your feedback and reactions on some of the proposals that we have presented here.
Matthias, is there any, because part of the preservative issue was regulatory, at least for us, is there any hope that the regulatory sort of like requirement will change soon? Or is it set and done? I mean, for multi-dose vial and preservative.
I don't think we had touched on that conversation during the regulatory convening a couple of weeks ago, but I don't know, Bill, do you recall any conversations about preservatives?
We didn't really get into them. No, I don't think so. But that part of that is because the regulatory convening that we had was really focused on clinical regulatory aspects. And we may have a second one, which will focus more on CMC issues and ways that we could, regulators might relook at kind of guidelines that and acceptance criteria for combinations. But because we focus really on clinical studies and the necessity for, how did human challenge models fit in? What kind of bridging criteria would you use? What kind of efficacy assumptions should you make? But not the CMC side yet. But hopefully we'll do something along those lines in the next several months.
This is Citron. Can you hear me?
Yes, but a little louder, Bob, if you
I've
can.
been thinking about preservatives for many, many years, and so far none besides 2-phenoxyethanol have surfaced as a substitute for thimerosal. A general response to the statement that manufacturers can work around problems, we're trying to give examples of incompatibilities, and I guess the problem is if we make too many examples of it, there'll be nothing that makes it through the screening. So maybe they'll be fixable and maybe not. So we understand your statement that the manufacturers are experienced and should be, this was stated a while ago, should be able to work through the complexities. So we're trying to be open to new combinations and maybe be careful not to overly judge and rule them out. So that point is well taken.
Yeah, Bob, I think the other thing to weigh in on too is, when you start making these multiple new combinations, you also have to look at the analytical toolbox that we have around the assays and how much compatible they are to be able to determine the stability profiles associated with these new combinations. The stability profile also is going to make a difference too. What are we going to actually be shooting for to allow us to make these combination products, right? So most vaccines stored 2 to 8 degree refrigerated conditions, going into some of the places where WHO may want them. Do we still need to meet the 7-day, 37 degree requirements for, thermal characteristics? because, there are gives and takes that you can actually do as a formulator to, balance the stability of different combinations. It just comes down to what is the long-term stability profile that you need to have for that product to make it a potentially viable option. And then do you have the analytical toolbox associated with it to allow you to look at the various stability profiles associated with the programs that you're looking.
Jeff, you're absolutely right. We haven't even touched upon the analytical toolbox and what we need to consider, because we still don't have the the combinations that are most likely from a programmatic perspective. I think that conversation will come next, and definitely that's been on our minds with Bob and myself talking about this. Definitely that it's going to be challenging. The more you mix, the more challenging it is to analyze, and to ensure that you have potency met for each of them analytically to be able to move it forward.
Yes.
Another.
Go ahead, Lakshmi. Go ahead.
No, another thing is about the the preservative. In this country, we don't use thimerosal at all, and whereas the rest of the world, thimerosal is still being used in many vaccines. So it's kind of a little complicated, especially depending upon where things are getting developed at the multi-dose level. So, and I totally agree with you on the short-term stability of 6 hours, but that works only for some of the vaccines. We could do that. So definitely there are a lot of challenges, and it would be good for everybody to list some of the things that they're considering or their experiences, which would help kind of shape this concept of what we're trying to get at.
Great, thank you so much, Lakshmi. So I propose that we move ahead. We just got a few more slides left. All of your comments are noted and will definitely help us to further improve this work. So let's move on to actually the next stage, which is, I think, Jeff, you have mentioned, which is about stability and storage. And how does that impact the likeliness of combining different vaccines? We have two rules here. One is that vaccines can be very likely combinable if all demonstrate stability under the same temperature range, are formulated in the same physical state, and do not require specialized storage or handling, like hexavalent vaccine or like a combo of PCV and meningococcal vaccine. The second rule is that vaccines can likely be combinable if they have different storage requirements with some changes, such as aligning to the more restrictive storage conditions, or using some novel devices like dual chamber presentation, or adjusting formulation in order to improve that shared stability. And an example here is DPT and TCV, which have very different values policy. They are stored at different temperatures. And because of that, if they were to be combined, hypothetically, their temperature ranges would need to be adjusted, or one would have to be compromised over the other. And how would that impact then the delivery of such a vaccine? What we believe is not likely combinable are vaccines that require, if they require incompatible storage formats or temperature conditions that cannot be aligned without compromising stability or efficacy. And this is because such combinations would degrade or destabilize one or more components if they stored outside the optimal range. They would require conflicting formats like lyophilized and liquid components that cannot be co-formulated and co-packaged. That would shorten the shelf life of one vaccine versus another if it's forced to be matched for the conditions of the other vaccines, and also trigger manufacturing or distribution challenges. For example, if one vaccine must be stored at -17 where the other does not, it makes it particularly complicated. And some examples here are mRNA vaccines, which could be combined with, couldn't be combined with alum adjuvanted vaccines, because mRNA would require cold chain and preservative-free formulations, where alum formulations will be incompatible with such requirements. So again, let's take 5 minutes here on the reactions to storage and stability, and what will be your feedback on that topic?
Yes, one of the things that I would question is the second bullet there about lyophilized and liquid components that can't be co-formulated or co-packaged easily. I don't know if that would be as big of a challenge as being made out, right? You could have your lyophilized version, you get your liquid component, and then you could use that as your diluent to reconstitute the lyophilized material to make your combination product, unless you really had a dramatic stability difference in pHs, sort of like we were talking about before. One could envision you could co-package a lyophilized and liquid image together. Most of the time, lyophilized products, you end up storing at 2 to 8 degrees, similar to your liquid formulation. And now your liquid combo becomes your reconstitution diluent, as long as the buffers and pHs are in the same ballpark, right? Because your reconstitution time is going to be short and your administration time will be short after that. So the amount of time the liquid and lyo products are being combined is going to be an hour, maybe 2 hours at a physician's office, which likely will not impact the stability dramatically.
Thanks so much. A very good point. Lavit, Jambou.
Right. Hi. This is a nice presentation. I have 2 quick questions. Is our idea of combining all this information is to bar certain combination, which we want to label that they cannot happen? And we want to categorically, you can say, label them that this is not feasible or possible in future. And second question, are we looking from a different angle? For example, let's say, which antigen can be combined based on their immunological similarities? For example, a time of administration or likely which are combining, let's say, which are falling in the same range of disease area, rather than just be on the physiochemical or physiochemical properties.
So let me start with that one first, and these will also be addressed. There are various stages of the feasibility assessment. One of them is the programmatic feasibility assessment, where we looked at some of the questions. We are looking at some of the questions that you have asked, and then the result of that feasibility assessment, the vaccines that pass that feasibility screen, will then go on to this technical feasibility assessment part. And this is because we don't want to evaluate all possible combinations. We really want to focus on those that are programmatically feasible, just to make our life easier as well, and actually not evaluate vaccines that are impossible to take place in real life. And the purpose of why we're focusing particularly on not likely is because here in the technical feasibility assessments, yes, we want to develop rules that would determine which vaccine combinations can move ahead with the evaluation, and those that cannot move ahead in the evaluation. And that's what we are focusing on here. Because if we determine these well that cannot move ahead, that will help us determine which vaccines end up in the final evaluation. If here we have some errors as to how we look at the technical feasibility, not likely technical feasibility, it means that we either include inappropriate vaccines, or that we, it's more that we actually skip vaccines that could actually be technically feasible, but because of the rules that we had identified, if they are incorrect, we could omit those. And as a result, a vaccine which would be very well programmatically feasible, it could have been technically feasible, but just because of our rules, we have not incorporated that vaccine in our analysis. So this is why we're focusing on that part, just to make sure that we're not throwing out vaccines that could potentially be technically feasible, because we have some inconsistencies in how we define these criteria and rules. Please.
Just a follow-up question on this, the same aspect on the last one. So does this mean that the vaccine which were clinically relevant, but because of the technical incompatibility, we need to drop out?
I think we want to highlight the challenges. So out of the vaccines that we find are not likely to be feasible, I think we also want to highlight what are the challenges that prevent these vaccines from being feasible. And through that, conduct some analysis and assessment of what would be the needs for research in order to make these vaccines feasible. For example, we may find that a major obstacles for combining these vaccines may be incompatible buffers. And because of that, we could then later propose there needs to be research on perhaps additional buffers, stability, exchanges, etc., in order to be able to make combination vaccines suitable. Just an example, but that's one of the insights that we're hoping to get out of these analysis and out of understanding which vaccines combinations are not likely to be combinable and also why. So in the interest of time, Lavit, yes, please.
Yeah, great. Thank you. That answered the question, but it will be really helpful when you're going to publish, please share the clinically relevant combinations also.
We'll do that. Thank you so much, Lavit. And Jules.
Yeah, just quickly before I forget, I want to propose two things. One, I think the discussion, it indicates that there are level of complexities that we probably would gain from having you discuss with the specific at different time with specific areas of expertise. On my side, I have people who are like high-level engineer type that will say, yes, this combination or this formulation, the stability and whatnot. And the second group, and that would be a separate discussion. It doesn't have to be, if you can sort of like spare the time. And the other group is the regulatory. Again, we already have experience, I mean, hitting the wall with some of those discussions. Maybe it's a time for us to revive it because over the last several, I mean, couple of years or more, we ran into the regulatory challenges of some of those combination, I mean, use of preservative and this sort of thing that warrant its own session. So if you agree on principle, I will propose to you that, I mean, I set up separate meetings with technical, with those groups. I mean, at least those two groups on our side. And you don't need to probably, I mean, it can be 40 minutes. It can be, I mean, less than that even if it is very, very pointed discussion.
That's very helpful, Juice. Thank you so much for that offer. We'll definitely follow up. I think what we had envisaged for now as to be the next steps is that we will share this presentation with all of the meeting participants in an email, and then probably follow up with individual companies to be able to collect feedback at the company level. And then, I think maybe that's where then you could indicate you should have a call with these colleagues and these colleagues and these colleagues in my team, and then we'll be glad to take up this offer and have individual calls to collect deeper expertise and to have deeper level conversations about some of these topics.
Thank you.
Thank you, Jules. So I have two more slides on the rules, and then I have one finalizing slide that summarizes some of these challenges that we are seeing here. So just the last one, sorry, on vaccine formulations, but here looking at the manufacturability component. We have two rules here, which is that vaccines are very likely to be combinable if they can be manufactured using existing infrastructure, equipment, and processes within a single facility under an integrated quality system. An example here could be a pneumo vaccine combined with meningococcal vaccine, conjugated vaccines, because there exists similar conjugation and purification processes, and they are often manufactured in shared platforms, or a hexavalent vaccine. And then a vaccine that is likely to be combinable if manufacturing is feasible with modification to processes, equipment, or different sourcing strategies. What we think is not likely to be combinable is vaccines are not likely to be combinable if they require fundamentally incompatible manufacturing processes, facility capabilities, or regulatory classifications that cannot be aligned without major redesign or risk to product quality. This is because they could require different biosafety levels, which would make it impossible to produce both antigens in the same facility. That would involve incompatible production platforms like those that are a live virus grown in eggs versus mRNA or recombinant, etc., because they demand completely different equipment, containment, or sterilization practices. They could also lead to cross-contamination due to incompatible facility or shared equipment that could not be easily decontaminated. There could also be some intellectual property barriers, or they could require specialized formulations or processing steps that are beyond what currently exist in manufacturing facilities, and demand significant facility investment or major redesign that is not justified by the expected return on the potential product. So for the last time, let's stop here for a very short discussions and your reactions on manufacturability. I think I've already heard that we need to add here the analytical toolbox and how do we factor in the analytical component and the tools and assays that exist for different vaccines and what's the overlap between them. So I noted that, but I'm open to your additional considerations as to what else should be included here. but I think we don't have any additional comments. So I think we can move on to the next slide, the last slide, which is just a summary of what we went through today and some indications of what the next steps would be. PATH and WHO together, we're developing this framework that we just presented to you, which would help us to identify, analyze, and prioritize combination vaccines. And because of that, we're really requesting support from your colleagues, from DCVMN and IFPMA members, to help us informing the technical feasibility of combining different vaccines. You have noticed that we don't have all of the technical expertise, and this is why we're hoping to connect with you colleagues so that you can tell us what works and what doesn't work, and how can we factor that into our decision processes. We're particularly focusing on the not likely definitions of criteria and rules, because these are the ones that will determine which vaccine combinations will actually remain in scope. We wouldn't want to throw out potential combinations vaccines that could work, but just because we haven't developed our rules correctly, we would potentially throw out such vaccines. We're requesting your feedback. You could also submit that feedback via email to myself or to my colleague Farzana from PATH. And I will send you the presentation today. What you could do is you could provide additional feedback as comments in that presentation. Please consolidate within your company, within your organization. And if you could collect that feedback and send that feedback back by the 2nd of May, and should you want us to talk with some of your colleagues from your organizations where you think we could really benefit from better understanding of what are the rules and criteria and how do you factor that in, how do you view this technical assessment in your company, we would very much be open to that. I understand that there may be a case where the information that you are providing is confidential. If that is the case, then please say so in the email. What we will do is we will ensure that that information doesn't get published. We use it to inform our selection, but that information does not get published. And we would like to, of course, thank you for your contribution to this project. Many of you have highlighted that the engagement with industry is essential. So we're really hoping that you will give us feedback that would help us further define some of these rules and criteria. And unless we have some final thoughts, Bill?
No, I think it's a good discussion, and there's a lot of activity in the chat, as many people have seen. I think a number of the comments illustrate the challenge here, which is trying to do something, trying to get some kind of technical feasibility filter so that we don't waste our time trying to prioritize vaccines that can't possibly, combinations that can't really be made without extensive R&D and innovation. But at the same time, we don't want to declare, oh, this isn't possible, when it very well could be possible, and there is evidence that it is. So this is what the balance that we're trying to strike. I think the few of the comments have been very clear. Manufacturers know much more than, collectively, the manufacturers know much more than any of us do. And we can't really presume that, oh, here's the fixed rule, this is not possible. So we want to highlight, I think, what is programmatically interesting, makes sense. That's something that we are working on, which we didn't discuss much here, but that's it. And then the idea was to apply some kind of sorry, that video's off. Some kind of technical filter so we don't waste time saying, oh, this would be a great combo, when it's really something that is going to require tremendous effort. But I take your points. I mean, we've been hearing that don't be too prescriptive, don't sort of assume that this can't be done, et cetera. And I think that's a really good point. On the other hand, are there no rules? Is everything possible? We should just not even bother to do this filtering. So I think that's the challenge. And I think we've assumed that, yes, we want to apply some kind of filter, but we want to be rational and grounded. And that's what this is about, this feedback and future feedback.
Great. Thank you so much, Bill. And thank you so much, colleagues, for joining and for sharing your feedback. We'll follow up through email, and we look forward to having further conversations with your colleagues.
Are there is there any final comments? Because I know some people were, this is an important discussion. I mean, this is why we're reaching out.
Bill, I think, I mean, you come from us, so you understand some of the, and I agree with your point. We cannot say it is impossible, and it's not it's not the technical impossibility that scares me. I mean, as I said at the beginning, business-wise, some combinations, we already know that it didn't work financially. I mean, we can, so that one. I mean, so there are a number of things that we will need from WHO and from other partners to support so that if something is operationally at least in the field needed, that indeed there is a reason to do it on the business side. So we have to have, it's a marriage or a divorce or whatever. And so, but the technology, and we know, even lay people like me, we know that some combinations are not going to work. But given time, you can always find. We have vaccines that are minus 70 degree, like our Ebola vaccine. You want to combine something that is like stable at 2 to 8 degrees, that clearly there is a mismatch there. So there are something that we already know the answers, and some things that even if we know the answer technologically, we know the answer business-wise. And some, I think, raise the issue, I think it may be right in there, where you have geographic differences in needs. And for manufacturers, it's a challenge. If something that is only used in Africa, you want to combine something that is needed in Greenland, at some point, I mean, it has to make sense somewhere in the middle. And those are some of the issues. But I'm going to organize on my side with Matheus and some of my internal colleagues that are engineers, so that we knock out some of this impossible. Is it sure that it's impossible? Because either we tried or we haven't tried. If we tried and we know for a fact we are not going to be able, we can start the conversation there. If we know that it is possible, but it's just a business decision, that's a different question. So there are a level of questions that we can address differently. But we need to open the platform for this discussion. And Bill, we can coordinate this. And I'd like you to be online with Matheus when we discuss engineering. The regulatory folks, they have their own concern. That will be a separate meeting, or during the same meeting we have. Anyway, different combinations we can think about. Thanks, Matheus. But really, I appreciate. There is an interest in my company, but at the same time, it's a bit scary.
No, but Jules, this is exactly the point of this whole initiative. We people who have been working in companies and industry know that. I mean, I have personally been involved with beautiful combinations that just technically were fine. Clinically, we're perfect. Regulatorily, we're licensed, and then just died because policy wasn't there. There wasn't a market, things like that. So this is exactly what we're trying to do, is at least openly walk through the processes so that at the end you have some combinations that people go, yeah, I see where it goes. Programmatically, it makes sense. I see the policymakers have been involved, so they're aware of it. The regulators hopefully are aware of it, and it becomes more feasible. That's exactly what we're trying to get at.
Thank you.
But can I actually ask a question? Because this is a great group to ask. We have been talking internally about the value of having some kind of regulatory convening that is focused on combinations and CMC, and whether there are things that could be done from the regulatory side a little differently. So we had this meeting a few weeks ago, which was on combinations and regulatory, but it was specifically focused on clinical regulatory. This was in Rio de Janeiro. I think Rajinder, you know about this. A number of people know about it, and we're there. I don't think Merck was there, but a number of people, and we'll publish it. But there was a number of ideas that came out of that about ways regulators might, behave a little differently when it comes to combinations, because it is so hard from a regulatory standpoint. It's so complex. do you, my question, this is a real question. You can say, no, I don't think so, or yes, or whatever. Do you think it's worth having some kind of maybe one-day convening to talk about with regulators? A lot of it, the point is having regulators there and some developers to talk about, are there ways in general that that on the CMC side, some of the regulatory constraints, guidelines might be altered? Is that something worthwhile or not? Or is it like a fool's errand?
No. For Mark, I think it will be worthwhile. I mean, I have a few, one or two of my regulatory colleagues, Michelle Gunn is a regulatory expert, but I would like more, I mean, the CMC and so, because there are complexities that I don't personally understand. I know that it is a challenge, but I don't know the specific, sort of like, what is it technically, because that's not how I was trained. So having a conversation, that's why I want to separate the engineer type, I mean, manufacturability from regulatory, because it's a different set of issues. And you want to give the platform for people to air out what are the opportunities, what is not a problem that we may think is a problem, and what is just like, you know what, we don't want to get there because we will be burned. And so that we amateurs stop dreaming and come back to reality. But
He's a
I mean,
dreamer.
don't stop
Yeah.
dreaming. I mean, it's good.
He's dreaming. Rajinder, what do you think? I'm looking at you. Do you think that's worth doing or not? Or what do you think?
It is certainly worth doing. My only suggestion would be that we should be able to, first do the CMC part, come with some kind of practical suggestions that this could be feasible, and then go to the regulatory group. I totally agree with Jules that we should not mix the two, but have a separate dialogue with them and then go to them. Okay, these are the possible combinations. What do you think? Is it regulatory pathway is established, or is it possible, or challenges, or whatever? So I think that may be a right thing to do, but definitely the regulatory advice would be required before anything is frozen.
Okay, thank you.
Great, thank you so much. So Bill, we think we're good to close?
Yeah, no, I just wanted to make sure nobody else had anything that they wanted to say, because this is just the beginning, right? We have other consultation in the future that we're planning. This was just to try to talk about general rules and guidelines.
Exactly. Great, so I think we can close. Thank you so much, colleagues, for your feedback. Appreciate that, and we will connect through email to get your further insights. Wishing you a great afternoon. Bye.
Thanks, Matthias.
Thank you. Bye-bye.